Do you have a fear of swallowing large pills? Does a doctor give you a script and you become a little bit concerned because you're thinking, I hope these aren't too big for me to swallow, or what am I going to do? Am I going to have to crush them up? Do you want to take supplements or vitamins, but you just find that the best ones are the biggest? Well, you're not alone, because 1 in 3 people in the United States suffer from a fear of swallowing pills. And it does have a name. It's known as pill phagophobia. And today I will assist you in fighting that fear. My name's Yvette. I'm a psychology student, and I'm going to take you through some behavioural modification steps to adjust your behaviour. Now, pill phagophobia, it's not surprising that it's common, because our natural instinct as humans is to chew and soften our food before we swallow it. So it's only natural that when you take that out of the mix and you're trying to force yourself to put a hard substance in your mouth and then swallow it, that it's going to send that natural survival instinct into a bit of a tailspin. Now, you may have already had an experience, maybe in your childhood, where you went to swallow a large pill and it got stuck in your throat. And this is quite common too. And having that traumatic experience mixed with the contradiction it makes to our survival instinct, it's only natural that a lot of people are going to suffer from this. And the struggle is real. And it can be quite fatal, because if you have to take, say, an antibiotic, for example, and the antibiotic cannot be crushed, or otherwise it will not have the same medicinal effect, you're putting yourself into a bit of a situation. So the best thing to do is to first have a look at the way that you are swallowing the pill. So before we go into anything else, it may actually be the technique that you're using. A recent Harvard study found that the traditional means of putting the tablet in your mouth and then swallowing it and tilting your head back whilst doing so is not the best way to tackle complications or tackle your fear. There's actually 2 other methods that are much, much more successful. The first one is called the pop bottle method. Now, the pop bottle method has been found to be best for hard tablets. Now, what you do is you get a bottle of water, you put the tablet in your mouth first, and then you drink the bottle of water by putting your lips around the top of the bottle and making sure that you do not remove your lips from the top of the bottle like so. The second method is called the lean forward technique. And what that involves is putting the tablet in your mouth, taking a mouthful of water, and then surprisingly not tilting your head back, but tilting your head forward like this and swallowing the tablet. And apparently that works much better in opening the back of your throat up. It makes it easy to swallow a large one. Now, if you've tried these methods and they're not working for you, then it would be my recommendation to undergo some kind of behavioural modification intervention. And you can do this yourself. It'd be wonderful if you've got a spouse or a family member or a friend that can assist, but it can be done on your own. And most importantly, you need to want to change. You need to feel it with all your might, and then you'll be able to get through to the other end. So what we'll do is we'll implement what is known as a graduated exposure technique. It's otherwise known as systematic desensitization, and it basically means that you will present the stimuli, the anxiety-producing stimuli, to yourself long enough that it eventually decreases the intensity of the emotional reaction. It's used a lot for arachnophobia patients. So if you have a fear of a spider, you will gradually get a real live spider close to the person. You may start off just having about 1 meter away, then 30 centimeters away, and then eventually the objective is to have a tarantula in your hand with no levels of anxiety, and it works. And it's a classic behavioral principle or behavioral strategy, but it is because it works. And sometimes in life, that's just how simple things need to be, and especially with phobias. So in your case with your pill phobia, number 1 is to assess yourself. You need to assess what they call a baseline assessment. So you need to work out, where are you now? Okay, where are you at in terms of your fear, and what is it that scares you the most, and how scared are you? So get yourself with some tablets that you would consider fear-provoking and work out, what is it? Is it the texture? Is it the size? Is it capsules? Is it just tablets? And then you try to ascertain exactly where your fear is. And another thing is that you really want to be rating your level of anxiety through this process. So a great measure of anxiety is known as SUDS, S-U-D-S, and you can Google it. Quite easy to get. It's known as the subjective units of distress scale, and it starts at 0, moves its way to 100, 0 being completely chilled and laid back and relaxed, and then you've got 100, which is extremely anxious and distressed, and you just can't concentrate on anything. So you might find yourself at that baseline at the start of the journey where you're rating yourself somewhere in the 70s or 80s, way up there, and it's good to continue measuring yourself through that whole process. So the next step would be to develop what we would call is a fear hierarchy. So it's your fear hierarchy of pills. You'd start off with something that's not so scary, maybe a little bit scary, and then you gradually increase, maybe in size, maybe in different texture, and you're going to be moving up to that ultimate, the pièce de résistance of that tablet, where at the moment scares the bejesus out of you and you don't think you can have it. So once you've developed your fear hierarchy, set yourself out a timeline, and then you're going to say, okay, for the next 6 months, twice a week, I'm going to have a little session. I'm going to get out these pills. I'm going to start with hierarchy 1, and then I'm going to overcome that one and maybe instill some of the different pill swallowing techniques that I mentioned before. I'm going to get over that stage, and then I'm going to move on to the next, and then the next. Once again, great if you've got somebody who can assist you with this, because it's always great if you've got someone edging you on. It's quite difficult to do on your own, but it is possible. And then also print out maybe 20 SUDS ratings, because what you want to do is every time that you present it on a different level of pill, you want to be rating your anxiety. And it's really important to do, because what you'll be able to see at the end of the process is you'll be able to see a documentation, like in your face, you'll be able to see the anxiety levels slowly reducing bit by bit. And it will give you a real sense of accomplishment and probably give you more confidence to move on to the next stage. Now, remember, reward yourself. You cannot underestimate the power of positive reinforcement. So what I would suggest is find something that you like. I mean, you know yourself better than anyone else. What is it that really motivates you sometime? Is it going out and buying something nice? Is it a certain kind of food, a chocolate cake, or a bar of chocolate that you just absolutely love? Reward yourself. Say you're going to give that to yourself. You are, once you get to that level, and once you achieve that level that you're moving on from. So make sure that you follow through with it, that you give yourself that reward. Don't just think it, actually do it and mean it. And then that shows that you're really taking this procedure very seriously and this whole process very seriously, and you're more inclined to get a better result at the end. So once you've actually got to the top level, and you'll be very, very proud of yourself, and you will get there, and you'll most likely find that when you do have the worst case scenario pill, a really, really large one, and you swallow it with ease, and you probably mark off your anxiety, maybe being down around 10, like no anxiety. You'll feel a great sense of accomplishment. But it's very important to do a follow-up analysis after that, and you really want to start going back maybe 2 weeks afterwards. If you haven't had the opportunity to be presented with the stimuli in day-to-day life, get yourself a big vitamin and try it out again and see where you're at. And then 2 weeks after that, and continue to do that follow-up. Although follow-up might be easy, because you might, in your day-to-day life, like I said, have to take one of these tablets, and then you can rate yourself again to see how you went. But I'm sure that you will do extremely well as long as you're committed, and as long as you deeply, deeply want to change this behavior. It will improve your life significantly, and it may save your life. So thank you for your time today, and good luck on your endeavours in battling this pill phagophobia.